Dr. Abha, thank you for joining us this morning.
Good morning, ladies. Thank you for having me.
All right, so let's start with just some advice that you have for people if they are headed out for spring break.
Well, the typical advice would have been sunscreen, wide-brimmed hats, and that sort of a thing. But in this day and age, we're going to ask that you get tested 1 to 3 days prior to travel. We're going to ask that you keep your masks handy. We're going to ask that you maintain 6 feet divide. And listen, if you're traveling to states that haven't been observing COVID precautions and the CDC guidelines in the manner that your departing state has, like Michigan, please maintain the same provisions you have been prior to travel, please. Furthermore, take proof of vaccination. So if you've already been vaccinated, take proof of that card with you. That might prove absolutely invaluable when you're away.
Absolutely. And is there any recommendations on, or helpful tips on checking those places, the states that you're going to, what their laws have been looking like, and maybe should you get tested when you get to your destination?
Correct. So if you go to the cdc.gov and specifically look at destination, every state, every locale, every country will have its stipulations. So imagine you get to an off-site destination outside of the United States and you do not have requisite paperwork that says you've been vaccinated. The last be detained in that country. So absolutely, prior to travel, much as you would do if you were trying to immunize before going to a foreign country, think of it that way. This is an additional form of protection, both for that country you are visiting and for yourself. So treat it really seriously and go to cdc.gov. That's a great question.
Is there anything else that you just want to add as we wrap things up here? Obviously, every day things are changing, numbers are starting to increase again. Just anything that you want to leave our viewers with?
Well, Deanna, you do such a wonderful job as a team in letting us know what's happening. And it's really for people to accept the reality. We have all 3 variants now in Michigan. The UK variant has already abounded for quite some time. What does that mean? It means the risk of acquisition of this virus is heightened. It means getting to DeVos Place and getting vaccinated becomes that much more imperative. And it means we cannot let our guard down. We're wearing masks and face shields and things of that nature are concerned. I'm going to leave you with a quotation. When watching after yourself, you are in fact watching after others. So whatever you do, behave in a manner that suggests you care not merely for yourself, but you care about those around you.
Wonderful. Great tips there. Good seeing you again, and thanks for all of that information.